Thank you so much. It's an incredible honor to be here. And let's just see if we can get back to the beginning of this day. There we are. I mean, inventors always have a hard time. I have a younger brother who grew up in Bell Labs, and to this day he has a framed letter on his wall that was written to Alexander Graham Bell by the president of Western Union, essentially saying, well, we've had a look at this invention of the telephone of yours, and it's kind of interesting, but we're convinced that Americans are going to be happy with telegraphy for at least the next century. And that's really our challenge in wireless health is, how do we really break that paradigm and invent a new way of delivering healthcare? Because it's clear that the healthcare system we have right now, where 70% of our healthcare dollar, actually heading for 90%, is spent on the care of chronic illness. And yet our model for taking care of chronic illness is you go to the doctor every 6 months, he tells you what you did wrong over the last 6 months, and you try to do better. It just doesn't work. And here we are spending more than $2 trillion of our GDP and bankrupting our country. So what we have to do is figure out how to make the care of chronic illness an ongoing phenomenon, one where we're using as little as we can of expensive resources and as much as we can of resources that are easy to come by. And that's really why we went after diabetes first, because we're talking about a condition that affects 28 million Americans. The CDC says that 1 in 3 people born after the year 2000 is going to have diabetes. It already eats 1 in 10 dollars that we spend on health care, and it's rapidly rising. And it's a condition where the primary caregiver is actually the patient. It's the person who has diabetes, or in the case of people who need help, like children with diabetes and elderly people with diabetes, the primary caregiver is a combination of the affected person and some relatives who spend a lot of their lives trying to help that person. Except we have this paradigm for taking care of it where you're supposed to stick your finger every couple of hours, take a reading, write that down in a logbook, take the logbook to your doctor every 4 to 6 months and talk about what you did wrong. And it just never happens. So not only do you have a flawed process, but you wind up with a result that leads to amputation, stroke, blindness, heart attack in far too many people, where those outcomes are completely preventable if only we can help people control their blood glucose adequately. So rather than try to tell you, our story myself, I brought you a short video just to give you a sense of how some other folks are telling our story.
And diabetes impacts the lives of nearly 26 million Americans. And according to the Texas Diabetes Institute, it's the 4th leading cause of death in Bexar County. The process of managing the disease can be overwhelming, but modern technology is making it easier. Sarah Fergani introduces you to the potentially life-changing technology.
Well, this Telcare blood glucose monitoring system here was released just weeks ago, and it certainly makes managing diabetes a whole lot easier. This here can actually communicate with your iPhone, with your family and doctors in just seconds. Now comes the first ever FDA-approved wireless capable glucose meter made by Telcare. It talks to your iPhone, iPad, and doctors instantly.
I can get on my iPhone and I can go to my Telcare and I can look and it will tell me what my blood sugars have been.
In just 5 seconds, Casey could see her blood sugar levels on her iPhone app. The results are sent immediately to a private online database without Casey ever having to manually plug it into a computer to upload data. The readings can also be accessed on a password-protected website by anyone who has permission, like family members or doctors.
For the device just to send the blood sugars for you and take out that extra step, it is fantastic.
And this is important for a lot of people. Telcare is a new diabetics meter. It could dramatically change the way people who have diabetes track their glucose levels. So from DC, this week's All Things Digital, we welcome in Walt Mossberg, the personal technology analyst at the Wall Street Journal. His column about this is in today's journal. Good to see you as always. Walt, tell us about this.
Well, Connell, this is it. You're right. It's basically a step toward taking these home healthcare devices, and in this case particularly the ones for diabetes, and beginning gradually to move them into the era we know about from these things. We're surrounded by this great technology, except when you have to take care of your health. Then the technology is 15 years old and it's really crude. So what they've done is not going all the way to the sophistication of an Android phone or an iPhone or something like that, but this is the first glucose meter, tracks your sugar, something all diabetics have to do, and it's the first one with built-in wireless connectivity. It's using some of our modern technologies to begin to actually apply to helping us take control of our health. And I think the more that happens, not only the healthier will we all be, but the lower our healthcare costs will be.
One more thing. Mobile health technology can bring potential benefits to all of us, but it can be especially useful for people with diabetes.
What's the difference between life and death?
Dr. Jonathon Javitt of TellCare is talking about his company's new invention, a mobile blood glucose monitor that automatically transmits data.
All people have to do is put a drop of blood in this.
The patient simply applies a drop of blood to a strip and inserts it in the machine.
And as soon as you pull the strip, it automatically transmits. There's nothing to do.
It's sending data to server, and there it is. And it tells you data sent successfully. Good job. I like that. Patients usually do several tests a day. They can monitor their results over time by going online or just by checking their smartphone. New hope for making the lives of people with diabetes a little bit easier.
Thank you.
Thank you for choosing the TellCare board.
So, it's easy to talk about putting whiz-bang technology into an old-fashioned medical device, and it's too easy to focus just on the technology. What we're really focusing on is the fact that if you can just improve glucose control in somebody with diabetes by 10%, you lower the likelihood of blindness, stroke, amputation, heart attack, and the costs of diabetes by 38%. In fact, in 2007 dollars, it turned out to be a $3,400 per person difference to the employer, just associated with getting somebody into decent control. So it's not about putting wireless technology into an old device. It's about creating an ecosystem of care around a person who otherwise was in a silo for those 6 months from one doctor visit to the next, so that there's ongoing feedback. Because what we know, everything we know about medical education, is that anything you tell a patient in the doctor's office, and I spent 20 years practicing medicine full time, anything you tell a patient in the doctor's office goes in one ear and out the other, whereas the thing that you tell the patient right at the moment when the decision's being made, what people call that teachable moment, is the thing that makes a difference. So if somebody can look on their meter and say, oh yeah, I need to take another 2 units of insulin, or if I eat an apple at 10 o'clock in the morning, I'm not going to have that blood sugar bottom out right before lunch and get into a yo-yo situation. That's what really makes a difference in people's lives, and that's what we're trying to do. And if you take a look at the things that our patients are writing back and telling us, we're enabling people to function throughout the day in a far more ordinary way than they were ever able to do before. If you take a look at the kinds of things that parents are telling us, we're changing their lives. All of a sudden, mothers aren't the diabetes police. All of a sudden, their relationship with their child who has diabetes is not one of constant nagging and constant calling, and did you test, and why didn't you test, and no, you can't go over on that sleepover date because nobody's going to be watching out for your blood sugar. We have mothers writing and saying that we've just changed their lives. They don't have to be parked 2 blocks away from the school for hours at a time because there's no longer a school nurse in the budget who's going to call them and tell them what the blood sugar number is. Now all that has to happen is the child tests on the meter. The result is instantly on mom's iPhone. And for every mom who has a child with diabetes, there are 3 or 4 people my age who have elderly parents with diabetes who are in that same situation, where if you can be involved real time, you make the difference between another good day and an unexpected trip to the emergency room. Now, not only can we use wireless technology to change the lives of the patient and the lives of the involved family member, but we can do the same thing for the physician, the nurse, the diabetes educator, because all of a sudden, for the first time, we can put a dashboard in front of that busy health professional and say, here are your 1,000 patients with diabetes, and here are the 5 who really need attention today or something bad's going to happen, but here are the others that you really don't have to worry about today because they're doing what you asked them to do. And doctors have really never had that ability. If you were to, walk into any busy diabetes doctor, any endocrinologist's office today and say, well, how many of your patients are in good control right now? He'd say, well, I don't know. I can tell you about the last 20 people who came in, but I won't know how other people are doing until they come and see me. Well, all of a sudden we can know, we can reach out, we can actually impact on the health care of an entire population at a time. So the last place we're taking this is right into your iPhone, your handheld phone. Walt said, well, the meter's not an iPhone. No, but our apps are. So all of a sudden, we're able to create a whole ecosystem of care around a patient. If you take a look on the iPhone store right now, we're the top-rated diabetes app, and we've only been out there for 6 weeks. Well, it's fun to have an app that talks to a glucose meter, but what's going to be even more fun is a year from now, that same app is going to tell somebody, where's the nearest restaurant that has a diabetes-friendly meal? Who can I, what other people who have diabetes can I reach out and talk to today so that we can help each other live with this condition? So that, to us, is the real future. And thank you so much for inviting us.